Hey everyone, and welcome back to our channel. If you're on Medicare, or maybe you're turning 65 soon, you know how confusing it can feel. And all that mail, the commercials, it's a lot to take in, and just like everything else, Medicare costs change every year. So what's new for 2025? Well, quite a bit. From premiums and deductibles to some really significant changes for prescription drugs. There's a lot to unpack. We're going to walk you through the key updates together in plain language. So stay tuned, because knowing these shifts can help you set your healthcare priorities and keep your budget in check. It also saves you from the stress of surprise expenses. Let's break it down. So original Medicare includes Part A and Part B, and people often forget that Medicare has costs. While you work, you contribute to Medicare Part A by paying payroll taxes. Most people don't pay a monthly fee for Part A, which covers hospital insurance, because they've worked for over 10 years where Social Security taxes were taken out of their paychecks. If you or your spouse have worked at least 40 quarters, you won't have to pay for Part A. But if you don't reach 40 quarters and decide to join Medicare, you might have to pay. Uninsured seniors with less than 30 quarters can expect to pay the full premium of $518 each month in 2025 for Part A of Medicare. This reflects a $13 rise compared to 2024. For those who had at least 30 quarters, the reduced monthly premium rate for Part A will be $285 in 2025, which is a $7 increase from 2024. Even with premium-free Part A, you'll have costs if you use your benefits. The inpatient hospital deductible for 2025 is increasing to $676. Coinsurance costs for hospital stays are also going up. Since the Medicare Part A deductible covers your first 60 days in the hospital, in 2025, it will cost $419 per day starting with day 61 and will continue until day 90 in the hospital. If you go beyond 90 days in the hospital, you are now starting to use your lifetime reserve days, which run from day 91 to day 150. The cost per day for this period of time increases to $838 per day. It is also important to keep in mind that once you use these lifetime reserve days, they do not restore. This means that if you do not have a Medicare supplement plan and one day go back into the hospital and stay longer than 90 days, the expenses you incur for each of those days is 100% your responsibility. So as you can see, it is definitely important to have a Medicare supplement plan if you are on original Medicare. Now, if you go into the hospital and then require skilled nursing for rehab, then you must first spend 3 consecutive nights in the hospital to qualify. For qualified skilled nursing, Medicare will cover the first 20 days at 100%. From days 21 to 100, Medicare will cover all but the first $209.50 per day. After a total of 100 days, Medicare will no longer pay for skilled nursing care. Medicare Part B, which is commonly known as your medical or doctor's insurance that covers such things as doctor's visits, surgeons, and outpatient services, will cost you $185 per month in 2025 unless you are a high-income earner. Most people will pay the standard $185 per month for their Part B premium. In 2025, Medicare Part B deductible is going to be $257. Now, unlike the Part A deductible, which can be incurred multiple times in a calendar year, the Medicare Part B deductible can only be incurred once. So, after you have covered the deductible, Medicare Part B will pay 80% of the approved cost, and you will be responsible for the other 20% of those approved costs. It's important to note that under Medicare Part B, the 20% you'll be responsible for does not have an annual limit. This is just another reason why you definitely want a Medicare supplement plan to go along with your original Medicare. Jumping to Medicare Advantage. These plans combine Medicare Parts A, B, and many times Part D together. These plans can also offer supplemental benefits such as dental, vision, and hearing coverage. They have their own plan design and cost-sharing structures, typically in the form of a fixed copayment for doctor's visits rather than the 20% Part B coinsurance you pay with original Medicare. Premiums for Medicare Advantage plans vary widely, projected to range between $0 and $240 plus a month in 2025, with the estimated average plan costing $17 per month this year. Most Medicare Advantage plans also have cost sharing. Now, Some people also choose Medigap policies or Medicare supplement plans sold by private carriers to provide wraparound coverage for some of the out-of-pocket costs from original Medicare, like those deductibles and coinsurance amounts we talked about earlier. Medigap premiums vary by plan, and the insurance company sets the price. Some plans have deductibles. For example, for high deductible plans F and G, the deductible is $2,870. While not very popular, Medigap plans K and L come with out-of-pocket limits. In 2025, the new limits are $7,220 for Plan K and $3,610 for Plan L. Now let's move on to Medicare Part D, which is your prescription drug coverage. This is an area with some big changes in 2025, especially if you take expensive medications. Part D plans have monthly premiums, which vary by plan, estimated to average around $46.50 per month in 2025 for standard coverage. Approximately 8% of the people with Medicare Part D pay what's called an income-related monthly adjustment amount in addition to their premium. Part D premiums can be deducted from Social Security checks or paid directly to Medicare. There can also be a yearly deductible for Part D, which can be no more than $590 per year in 2025. After meeting the deductible, you move into the initial coverage phase where you pay a portion of your medication costs, usually a copay or even coinsurance. Here's the really significant update for 2025. There's a new $2,000 cap on your out-of-pocket prescription drug costs for medications covered by your Part D or Medicare Advantage plan with drug coverage. This cap is designed to provide financial relief for those folks taking expensive medications. This means that once you hit that $2,000 amount for covered drugs, you pay zero for any other covered drugs for the rest of the calendar year. And thankfully, the coverage gap, often called the donut hole, is completely gone starting in 2025. You don't have to worry about that moving forward. Now, this $2,000 cap isn't always as simple as just adding up what you pay the pharmacy. What counts towards that $2,000 limit is based on something called your true out-of-pocket cost, or TROOP. Think of TROOP like your personal tracker towards that $2,000 goal. Here's where it gets a little complex, and honestly, calculating this precisely on your own is not something you should attempt, nor should you expect an insurance advisor to determine it with absolute certainty. How your TROOP is calculated depends on whether your plan is considered a basic or an enhanced prescription drug plan. For a basic plan, it's pretty straightforward. Generally, what you actually pay out of your pocket will count towards the $2,000 cap. Picture a small bucket. Each time you pay a deductible or a copay or even coinsurance for a covered drug, a little flows into that bucket. When it hits $2,000, the bucket snaps shut and every covered drug after that is at no cost to you. So, if you're in a basic plan, only the money you pay out on covered drugs counts. So you likely will pay the full $2,000 out of pocket to reach the yearly spending limit. But for an enhanced plan, it's different. Enhanced plans often use low, flat copays. To keep things fair across all plans, Medicare says we'll count the larger of two numbers, your real copay or the standard benefit cost. That larger number speeds you to the cap, giving you protection sooner. Here's an example of how that would work. Let's say that you have an enhanced plan and take an expensive brand name drug each month that has a retail price of $1,000 each time it is filled at the pharmacy. In this example, we're going to say that your enhanced plan has a low fixed $47 copay that you pay to the pharmacy each time you have it refilled. The way that Medicare records how much goes into the bucket to reach $2,000 is by checking what you would have paid under the standard Part D rules. In 2025, the Part D deductible is set at $590, and then there is a coinsurance of 25% of what is left after the deductible. Based on this calculation, Medicare will put a $692.50 credit into your bucket instead of just the $47 copayment you made. Because of these complexities, especially with Part D and how the $2,000 cap really works, understanding the best plan for your specific needs is more important than ever. Medicare is definitely not a one-size-fits-all. Our team here at Senior Benefit Services specializes in helping people just like you, senior citizens ages 64 and older, who are on Medicare or getting ready to go on Medicare. We simplify things for our clients by breaking down complex jargon and offering one-on-one consultations. Our process is designed to be quick and easy. We call it the 3 steps in your done plan. You can call us for an easy price breakdown with no sales pitch. It takes only minutes to get you insured, and unlike those call centers you see advertised on TV, our service does not end after you get your insurance coverage. We offer our clients annual reviews to help guarantee that they always have the best coverage for them as your needs or the plans change. What's even better is that you're assigned your own personal advisor that will be your point of contact for as long as you're a client with us. We have multiple offices in Maryland, like Hagerstown, Thurmont, and Cumberland. Also, we're a leader in providing insurance plans designed for days retirees in Maryland, Pennsylvania, Florida, Virginia, West Virginia, and more than 30 other states. Don't try to figure out Medicare alone. If you're feeling overwhelmed by the changes for 2025 or just want to make sure you're in the best plan for your needs and budget, reach out to us. You could call us at 1-800-924-4727 or visit our website at www.seniorbenefitclient.com to learn more and connect with one of our trustworthy advisors. Reviewing your coverage each year is important, especially during the annual enrollment period, which is from October 15th to December 7th each year. We're here to make this easier and make sure you are protected when you need it most. We strive to simplify things for our clients and guide them step by step. If you found this video helpful, please give it a like, share it with anyone who might benefit, and subscribe so you don't miss our future tips on navigating Medicare and making the most of your retirement years. And thank you for watching.